Are you one of those people who keep seeing foamy or bubbly urine in the toilet and keep telling yourself it's just ordinary bubbles? Most times, it's not. Persistent foamy urine is one of the earliest visual clues that protein may be leaking through your kidneys. And here's the shocking part. Proteinuria is one of the earliest and most reliable warning signs that something is affecting your kidneys, blood vessels, heart, or blood sugar regulation. Many people feel completely fine while protein is quietly leaking through the kidneys, until the damage becomes much harder to reverse. In this video, we're going to break down what proteinuria really reveals about your heart, blood pressure, and diabetes risk. And I'll also share 3 very important tips that can help you reduce or even reverse proteinuria if you start early. Now, what does proteinuria really mean? Your kidneys have tiny filters called glomeruli. Their job is to keep large molecules, like proteins, inside your blood while removing waste. So when protein shows up in the urine, it usually means these filters are becoming damaged or weakened. But the deeper truth is this. Proteinuria is rarely just a kidney problem. It's usually a sign of systemic issues, problems affecting your blood vessels, heart, or metabolism. Let's break this down clearly. Multiple studies, including those published in journals like The Lancet, Circulation, and Kidney International, show that even small amounts of proteinuria significantly increase your risk of cardiovascular disease, including heart attack, heart failure, stroke, and peripheral artery disease. Why? Because proteinuria tells us that your endothelial cells, the cells lining your blood vessels, are becoming damaged. And endothelial damage is one of the earliest stages of atherosclerosis, the process that leads to plaque buildup, hardened arteries, and reduced blood flow. This is why doctors consider proteinuria a strong independent predictor of cardiovascular mortality, even if your kidney numbers are normal. Proteinuria means your blood vessels are leaking, and if the kidney's small vessels are leaking, the bigger ones around your heart may also be under attack. Proteinuria and high blood pressure. High blood pressure is both a cause and a consequence of proteinuria. When blood pressure is high, the pressure inside the glomeruli becomes too strong, and over time, this excess force begins to damage the delicate kidney filters. As these filters weaken, protein starts to leak into the urine. The damaged kidneys then respond by releasing hormones that push blood pressure even higher, creating a vicious cycle that keeps worsening with time. This silent progression eventually leads to chronic kidney disease, worsening hypertension, and a significantly increased risk of cardiovascular problems. Studies show that even mild proteinuria can indicate that high blood pressure has already been affecting your kidneys long before any symptoms appear. This is why proteinuria is often the very first red flag that hypertension is silently damaging your body. Proteinuria and diabetes risk. Proteinuria is one of the earliest signs of diabetic nephropathy, which is the damage high blood sugar causes to the kidney's filtering system. When blood sugar remains elevated for long periods, it irritates and inflames the glomeruli, stiffens the surrounding blood vessels, and weakens the protective barriers of the kidneys. As this damage builds up, proteins eventually begin to leak into the urine. What's especially important is that proteinuria can appear even before a person is officially diagnosed with diabetes. Its presence may be an early warning sign of prediabetes, insulin resistance, or metabolic syndrome. Research shows that people who already have protein in their urine are far more likely to develop type 2 diabetes within the next few years if they do not make lifestyle or dietary changes. In other words, proteinuria can reveal underlying metabolic problems long before your blood sugar test becomes abnormal. What else causes proteinuria? While heart disease, high blood pressure, and diabetes are the most common causes of proteinuria, it can also develop from other conditions such as kidney inflammation, infections, autoimmune diseases, certain medications, dehydration, or even eating a very high protein diet. In some cases, vigorous exercise can also cause temporary protein leakage. However, when proteinuria persists, it is almost always a sign that the kidney filters are being damaged by a deeper systemic problem. Common signs that may indicate proteinuria. One of the most common visible signs people notice at home is foamy or frothy urine. When protein leaks through the kidneys, it reduces the surface tension of urine, creating thick, persistent foam that looks very similar to soap bubbles. Many people flush this sign away, literally, thinking it's just turbulence from the toilet bowl. But when the foam appears consistently day after day, it can be an early clue that protein may be leaking. But proteinuria rarely comes alone. As protein loss continues, the body begins to show other subtle signals. One of the earliest is swelling, especially around the ankles, feet, eyelids, and face. This happens because the body loses albumin, a protein that helps hold fluid in the bloodstream. When albumin drops, fluid shifts into the tissues. People may also feel puffiness in the hands, shoes feeling tighter, or swelling that gets worse at the end of the day. Another common accompanying sign is unexplained fatigue. When kidneys begin to struggle, they don't filter waste as efficiently, and low-grade toxins can build up, leading to tiredness even when you've slept well. Some people may also experience changes in urination, such as passing more urine at night, having very pale urine, or noticing that the urine stream seems weaker than usual. In more advanced cases, proteinuria can cause loss of appetite, a feeling of heaviness in the lower back, where the kidneys are located, or muscle cramps, especially if electrolyte balance begins to shift. However, it's important to emphasize that none of these signs, whether foamy urine, swelling, or fatigue, can conclusively diagnose proteinuria on their own. Foamy urine can come from dehydration or forceful urination. Swelling can be caused by heart problems, varicose veins, or even eating too much salt. And fatigue has many non-kidney causes. These signs are warning flags, not final answers. The only definitive way to confirm proteinuria is through a urine test, such as a dipstick test, an albumin-creatinine ratio test, or a 24-hour urine collection. Physical signs can guide you, but only proper testing can tell you the full truth about what your kidneys are doing. 3 powerful tips to reduce or reverse proteinuria. 1. Lower kidney pressure with the right diet and minerals. To stop protein from leaking through the kidneys, you need to reduce the pressure inside the glomeruli. One of the most effective natural ways to do this is by increasing your intake of potassium-rich foods such as bananas, avocados, leafy greens, and sweet potatoes, provided you do not have advanced kidney disease. Adding more magnesium-rich foods like pumpkin seeds, spinach, and almonds can also help. At the same time, it's crucial to drastically reduce excess sodium in your diet. When sodium goes down and potassium goes up, blood pressure naturally drops, easing the strain on the kidney filters and lowering protein loss. In fact, studies show that reducing salt alone can decrease proteinuria by as much as 20 to 30%. 2. Fix insulin resistance to protect the filters. Insulin resistance is the silent force, driving both diabetes and proteinuria, slowly damaging the kidneys long before symptoms appear. You can begin to reverse this process by shifting to high-fiber meals that slow glucose absorption and keep blood sugar stable. Reducing refined carbohydrates, such as white bread, sugary drinks, pastries, and processed snacks, also gives your cells a break from constant insulin spikes. Simple lifestyle habits help as well, like taking short 10 to 15-minute walks after meals, which can immediately lower post-meal blood sugar. Certain foods, including cinnamon, ginger, and apple cider vinegar, have been shown to improve insulin sensitivity, while increasing omega-3 intake can reduce inflammation that worsens insulin resistance. Getting better sleep is another essential step, because poor sleep raises cortisol levels and makes insulin resistance dramatically worse. One of the most powerful tools you can add is intermittent fasting. By giving your body longer breaks between meals, fasting lowers insulin levels, improves metabolic flexibility, and allows your cells to become more responsive to insulin again. Many studies show that intermittent fasting can significantly improve insulin resistance and help restore normal kidney filtration in early stages. 3. Use kidney protective herbs and supplements when safe. Several natural options have shown promising results in studies. Omega-3 fatty acids help reduce inflammation and can lower protein leakage, while turmeric and its active compound curcumin are known for their strong ability to calm kidney inflammation. CoQ10 supports healthier endothelial function, which helps protect the delicate blood vessels in the kidneys. Green tea extract, particularly EGCG, reduces oxidative stress, and berberine improves blood sugar control, while also easing kidney inflammation. These remedies can be powerful in the early stages of proteinuria, but it's always important to speak with a doctor if you already have advanced kidney disease. Proteinuria is not just a kidney problem. It's a full-body warning signal that something is stressing your cardiovascular system, your blood pressure, or your metabolism. The earlier you take action, the more reversible it is. If you can successfully reduce blood pressure, lower insulin resistance, and protect your blood vessels, you can often stop protein leakage and dramatically lower your long-term risk of heart disease, kidney failure, and diabetes. If you found this video helpful, please hit that like button and subscribe to the channel for more informative videos like this. Thanks for watching, and see you in the next one.